Hello, I am Dr. Rajendran. I am a consultant neurologist, Apollo Hospital, Greaves Road, and consultant in ACE Neuro Clinic, Ananagar. Today I am going to talk about epilepsy. What is epilepsy? Epilepsy is a brain condition and it is characterized by recurrent, that is more than 2 unprovoked seizures. What is a seizure? Seizure, otherwise called fits, is an event due to increased and hypersynchronous electrical discharge from neurons, that is brain cells. Today I am going to talk about various kinds of seizures. All patients with epilepsy have seizures, but not all patients with seizures have epilepsy. Some terms I am going to talk. What is aura? Aura is an earliest part of the seizure, and sometimes it's often the only kind. A convulsion. Convulsion is a motor manifestation of a seizure characterized by tonic-clonic movements. Tonic movement is increased stiffness and clonic movement is a jerk. There are various kinds of epileptic seizures. Commonly we classify into 2 main categories, which is generalized seizure and partial or focal seizure. Generalized seizure is due to a brain dysfunction affecting the whole brain right from the beginning. And focal or partial seizure, the abnormality arises from one part of the brain and then spreads to involve the entire brain. There are various kinds of generalized seizures and partial seizures. Generalized seizures could be tonic seizure, clonic seizure, generalized tonic-clonic seizure, myoclonic seizure, absence seizure, and atonic seizure. Partial seizure is classified into simple partial seizure and complex partial seizure. The characteristic of generalized seizure, it may or may not arise from aura, and then a patient gives out a cry followed by uprolling of the eyeballs, and there will be stiffening of the muscles, which is called tonic phase, followed by jerking, which is called by clonic phase. This is the ictal phase, and this is followed by post-ictal phase. In majority of causes, what causes epilepsy? In majority of the cases, there are no causes for epilepsy, and this is called idiopathic epilepsy. In children, it could be due to cerebral palsy, birth-related abnormalities. It could be due to infection of the brain, metabolic condition, and certain structural abnormalities of the brain. And seizures can occur after a head trauma or due to certain heritable conditions. In adults, it could be due to a structural brain disease like a stroke, head injury, following brain infection, or could be due to tumor or toxins. What are febrile convulsions? In children from 6 months to 5 years, the children can have fits which is associated with fever, and convulsions usually brief. What is the outcome of a febrile convulsion? In majority of cases, in a simple febrile convulsion, the outcome is good. Whereas sometimes atypical febrile seizures occur, that is, seizure could be affecting one part of the body only, and there's abnormal development of neurological function, and such cases 5% of them can lead on to further seizures in adulthood. How will you diagnose seizure? It is purely a clinical diagnosis based on the patient's clinical history. The history from the witness is very important because many types of seizures there is loss of consciousness. The patient himself is unaware what is happening to him. Differential diagnosis, that is conditions you need to exclude which can mimic epileptic seizure. Most commonly syncope, otherwise known as fainting attack, and other paroxysmal events like metabolic conditions like hypoglycemia, sometimes migraine, a transient ischemic attack, vertigo, or giddiness. These need to be excluded by getting a proper history. Sleep disorders like parasomnias and some movement disorders can mimic epileptic seizure. What investigations is done when a patient is suspected to have a seizure? Basic investigations like blood investigations is done. EEG, which is electroencephalogram, is done in most patients, not only to support the diagnosis but also to classify what kind of seizure the patient has. Brain scan, either MRI brain or a CT brain scan, is usually done. Now we'll talk about first aid. What we should do in a case of epileptic seizure, what we should not do. First we'll talk about what we should do. We must allow the patient to have seizure, to complete it, because usually seizure is very brief, lasting for 2 to 3 minutes. Patient should be put on a recovery position, that is on his sides, roll him over his sides, either left lateral or right lateral side. This prevents fluids from getting into the lungs. Patient should be shifted away from any dangerous objects and to prevent him from having a self-injury. Seizure which occurs more than 5 minutes is called a prolonged seizure. It is a medical emergency. It can lead on to a condition called status epilepticus. So anyone having a prolonged seizure should be immediately transferred by ambulance to the nearest hospital with emergency. In the meantime, at home, certain procedures can be done. Usually administration of midazolam orally is helpful in aborting an attack of seizure. Alternatively, you can give a rectal diazepam. Now we'll talk about what we should not do. So do not attempt to force anything into the mouth of the patient. So you should not put anything like a pencil or a spoon inside the mouth, because there's a risk of causing choking to the patient. Even if the tongue gets bitten, it usually heals in a few days. And we should not introduce a finger inside the mouth, because the finger can be bitten by the patient. And do not attempt to stop the convulsive movements, as may lead on to injury to the patient. And do not allow people to crowd around the convulsing patient. And do not put any objects in front of the patient. So what is the treatment available in a case of epilepsy? The main treatment of epilepsy is anti-epileptic drug. This medication needs to be taken for quite some time, sometimes for years, or in rare occasions for lifetime. Usually single drug is started, then a second drug is added or it is replaced. Epilepsy surgery is an option in a minority of patients who do not respond adequately to anti-epileptic medication. And how long patient has to take anti-epileptic drugs? Generally, if EEG and MRI scan is normal, the patient needs to take about 3 years, and the patient should be advised never to stop medication without consulting the neurologist. Certain seizures like juvenile myoclonic epilepsy has a tendency to recur, so patient need to take medication almost lifelong. Why it is important to take anti-epileptic drug regularly? It's very important because to maintain a constant level of the drug in the system, to achieve that, the patient needs to take medication regularly. What are the other treatments available? Apart from medication and epilepsy surgery, there are 3 options that are available. 1, vagal nerve stimulation. 2, anterior thalamic stimulation. 3, closed loop responsive stimulation. Thank you very much. I hope this information is useful for everyone.